And now I'm joined by Dr. Madele Ogini, a professor and master clinician at Emory University and past co-chair of the National Hypertension Control Roundtable. Dr. Ogini and I will attempt to recap this convening and briefly discuss some key takeaways. That's a big challenge for us. So welcome, Dr. Ogini.
Thank you, John, for having me. And I will say that it's been a wonderful day of discussions, and I've been taking notes furiously. So thank you for the time.
Yeah, well, thank you for joining me. It's always an honor and a privilege for me to join you any place, even virtually. So, Madele, Paul Welton, who's an authority figure on hypertension, if ever there was one, reminded us that high blood pressure is the world's leading preventable cause of death. Can we be reminded too many times that hypertension is a more significant cause of death and disability than smoking, obesity, and diabetes?
Yes, John. I mean, Dr. Welton has been a leader in this area, pioneer in this area. But as we think about high blood pressure as a preventable cause of death, definitely the public, he pointed out something that the public doesn't hear enough. And one thing for us to take away is that 80 to 90% of cases of hypertension are really linked to modifiable risk factors. So that means that for most people who think hypertension is their destiny, they actually can do something about it. This is a real opportunity for us to change that narrative at the patient level, provider level, healthcare system level, and I'm glad that this convening focused on that.
Yeah, that was such an important point, and it tied right into Frank Luntz's comments.
Yes, you are exactly right. You know, two aspects of Dr. Lund's comments really were striking to me. You know, he was very candid about his struggles, about managing his blood pressure, and that he made it a priority, you know, to follow his treatment plan, even after suffering 2 strokes. You know, we usually don't think about the disability, the morbidity that comes from uncontrolled high blood pressure. He also made a blunt statement that all the data and facts about hypertension, they really are not persuasive to anyone else. Maybe perhaps to those of us who are here today. So how do we take all the information that we know, the data that we know, how do we translate it into meaningful feasibilities to help us achieve blood pressure control? And I'm glad that this was really focused on in this convening.
Well, me too. In fact, I think one of the key takeaways from this convening is that we must make the invisible visible. Yes. Hypertension, as we talked about with Frank Luntz, gets less attention than cancer or erectile dysfunction because the effects are invisible.
Yes, and I think that ties into the notion where we say, there's a saying that says hypertension is a silent killer. The thing about blood hypertension is that if you don't measure the blood pressure, you're never going to know that there's hypertension, you know. Frank and Laura Rees, they really made very strong comments that I think that, as you and I have talked before, we need to think outside the box if we want to achieve hypertension control. Some of the points they made was that us researchers, clinicians, you know, people that make decisions, we must rise to the place of taking these facts into visual storytelling. You know, when you think about all the scientific articles, especially in the time of COVID, we saw the impact of what we call graphic abstracts that really take the data, but with graphics, they create that visual story that is impactful for the general audience or the lay audience. You know, people usually respond to what they see and what they feel. Also, I like the fact that Laura helped us to understand why this is so. You know, visuals along with emotions are processed on the right side of the brain. So think about looking at a baby photo, when you see the baby, you don't just say baby, but you look at all the cuteness and all of that. So I think that if we can learn from that, instead of saying, oh, hypertension is a silent killer, but have graphical representation and also think about how we portray data. I remember that my first paper on hypertension, we actually had a piece that was a patient education perspective. So I think that to get to the audience, we need to think about creating visual. We need to think about the power of storytelling in hypertension control. And how can we take that and create a visual or graphical representation that resonates with people?
Yes, indeed. Both Frank and Laura said that we should help people visualize what hypertension could cost them. So I like your observation about the graphic abstracts, but then there's the other side of it, the emotional side. So people missing moments in life, like seeing their kids graduate or grandkids grow up. I'm reminded of the Tips from Former Smokers TV campaign, which Frank mentioned in his comments. That's one of the most effective public health communication campaigns ever because it does exactly what Frank and Laura recommended. And then Laura's point that repetition works resonates with me. She mentioned BMW using the ultimate driving machine tagline for 30 years. Hypertension needs its own tagline that we repeat over and over and over to position it at the top of consumers' minds. Model A, you made a statement more than a year ago that because it evoked a visual in my head, it keeps hypertension at the top of my mind. Do you remember what it was?
Yeah, I said uncontrolled hypertension is lethal.
Yes. And I don't know if that would work with consumers, but I wonder if we could use it to raise clinicians and health systems priority on blood pressure control. Would they choose not to act on something lethal in their clinics?
They should. Crystal's story about an FQHC improving hypertension control from 45% to 70%, it was in 1 year, was both inspiring and really should be commended. And we hope we can replicate this in other, settings. And not only did they
Absolutely.
achieve that, they are sustaining it. She and Dr. Philip delivered some key takeaways that I want to emphasize. They talked about self-measured blood pressure, that it works, is effective, but yet it is grossly underutilized. Crystal's program also demonstrated success with one, best practices, strong leadership, vision, and community involvement. And that is what we're seeing here today, where all the hypertension community, we have different stakeholders. So community involvement is very important. Clinical approaches really will not get us to where we need to be. It won't get us to that takedown of hypertension. It is important that we have community involvement, and I'm glad and really give credit to our mayors and the National Forum for their program, Move with the Mayors. So I think as we galvanize community involvement, community activism in terms of hypertension control, we will get to where we need to be. And I know we're going to talk soon about the vital conditions for health and well-being.
Yeah, absolutely. Becky Payne and her colleagues at the Ripple Foundation have done a great job, great work developing the vital conditions framework. And then it was great to have Crystal and SWLA Health Center provide real world evidence that the model works.
I mean, I think that is just so important. And I just want to repeat it again, that vital condition framework, it shifts from the social determinants of health, it shifts us towards actionable community change. Several of our speakers today have illuminated the importance of belonging and the civic muscle. That is really at the core and the center of the vital conditions wheel. People want to be recognized. People want to contribute. They want to have that sense of belonging in the goal of well-being and health. And this vital condition greatly affects blood pressure control, and not only that, overall physical and mental health.
Yep, indeed. Uh, Mayor Angie, Dan Lackland, and Becky Payne, they all agreed that we need to begin blood pressure management at younger ages. They pointed out people form healthy or unhealthy habits at a young age, and Mayor Deitch was diagnosed with hypertension in her 30s. People are having heart attacks and strokes at younger ages. So that panel gave examples of the power and efficiency of multi-solving interventions with cross-sector co-beneficial impacts. Mayor Deitch gave the example of Move with the Mayor events that get people moving, provide health education, increase social engagement or belonging, and increase civic muscle.
Yeah, those are really great examples of, community belongings and increasing the civic muscle. All of us here today, we have so many people here today. We're linked virtually in this meeting and have been in a lot of discussions about hypertension before. But I want to charge everybody today, what are we going to do differently? The National Forum, I'm proud to serve on the board, has created a distinctive value by doing something different today. The emphasis has been, how do we change how we communicate about hypertension so that it resonates and positions blood pressure management at the top of people's mind? This approach today is new, is different, is valuable, and I commend John and all the staff that put this together. Also, the story of hearing how self-measured blood pressure helps a community health center move from 45% to 70% and sustain that control. That must remind us that it is important for us to facilitate how we can have effective self-measured blood pressure. And finally, the shift from social determinants of health to vital conditions for health and well-being will serve the society very well, keeping in the center civic muscle and belonging. Thank you, John.
Well, thank you, Dr. Ogani. It's always, as I said, a privilege and an honor to be with you.
Thank you for the opportunity.
Absolutely.